Hey, this is Dr. Mo here at Chiropractic Care Center in Fairfax. We have Morteza. Morteza is a Facebook follower, and he's been watching me for 5 months now.
Yes.
So he's come in here. He has neck, low back pain, and mid back pain. So we're gonna treat him today, and then kind of go from there. And if you've been watching for a couple months now, you got to come on in. Let's get a free consultation. Let's check, see if I can help you or not. So let's go face down for me. All right, sir. Let's see. So one thing we notice is his leg length is off. All right. Another thing is if you could raise this leg for me. Perfect. And then this side. Perfect. So we got to get the range of motion back in here. So let's have this side up for me, facing this way. Beautiful. Deep breath, sir. All the way. There it is. One more. There it is. Perfect. Let's go face up for me. Okay. And also, you've been getting headaches as well, right?
Yes.
And you get it, what, every day, you say?
Every day, almost every day.
Okay. And you're on your feet all day and you work hard hours.
Yes. Just like yourself.
That's right. You ready, buddy?
Yes.
Relax as much as you can. Beautiful. There goes the ears. One more. Nice. How you feel?
Much better.
Yeah, look at the ears. So the one thing that happens is all the blood is getting up there. That's one reason he's getting headaches. It's all the things locking up there. There's no blood flow up there. So stay there. Move, scoot down just a little bit towards your feet. I'm gonna adjust you a little different than most things on the video here. Give yourself a big hug. I'm gonna take that pen out so you don't embarrass. Right here. Let's see where. Move down just a little bit more. Sorry. I want to make sure you're not perfect. Deep breath for me. All the way out. One more. Deep breath. That's locked up. There it is. Good. Let's go face down for me. Let me check a couple other things. Look at that. That's awesome. Now let's see if it improves a little. Raise this for me as high as you can. Nice. How about this one? Look at that. They're almost perfectly even.
Amazing.
I'm gonna try one. Take a deep breath for me again. There's one up here then. All the way out. Good. There it is. Got it. This signal. All right. So we're gonna go ahead and close this, but we're gonna go ahead and do soft tissue work on him, which we won't show. Kind of relax the muscles for him, and then go from there. So yeah. So you're watching. Come on in. We can help you.